What's up, loves? I'm Jessica Molina, and you're watching Now You Know. You do know there's nothing wrong with going to therapy, right? For far too long, taking care of your mental health has been stigmatized. But studies show that depression is on the rise in the United States, but treatment rates have not increased. Now, one of the reasons is definitely access. Many people who suffer from mental illness are the most vulnerable in our population, and they have poor or no health care. But there's also the stigma that's convinced many of us that seeking help for a mental illness is either something to be ashamed of or a sign of weakness. People's silent struggles are either killing them, making them want to kill themselves, or forcing them to live a life of isolated sadness, anxiety, and anger. And for communities of color, our apprehension to acknowledge each other's pain is causing dire consequences. A 2015 study from the Center for Disease Control and Prevention found that Latina teens had the highest rate of suicide attempts. And according to the Health and Human Service Office of Minority Health, African Americans are 20% more likely to experience a major mental health problem than the general population. Yet only about 1/4 of African Americans seek treatment compared to 40% of whites. Most chronic conditions or illnesses are met with empathy, concern, and an insistence on seeking professional help. But when it comes to your mind, people act as if you've made something up or you just need to grow a tough skin. And sadly, so many of us have bought into that lie. Now I get it. When you're struggling with a mental illness, you often feel shame and just want to crawl into your cocoon and be left alone. It's not exactly social hour, and the idea of reaching out to people can actually cause you more anxiety. But I wonder if there wasn't such an emphasis on making it look like we've all got it together, if we would feel a little bit less fear and tell people, nah, I'm not okay. Can we collectively agree to drop the facade and admit that we're all fighting one battle or another? Because personally, I'm in therapy and I love it, and there's no shame. Now, if talking to someone isn't your thing or it hasn't worked for you in the past, there are other options out there besides talk therapy. You've got music therapy, which has been shown to relieve anxiety and depression and help reduce physical pain. There's art therapy, which fosters improved self-esteem, self-awareness, and cultivates emotional resilience. You've also got dance or movement therapy, which helps you release feel-good endorphins and activates pleasure responses. Or there's wilderness therapy, which according to Psychology Today is the prescriptive use of adventure experiences provided by mental health professionals. Now, studies have shown that people who participated in wilderness program treatment maintained positive changes 1 year later. See? There's something out there for everyone depending on what you're looking for. Now, I also can't deny that many mental health professionals have failed communities of color. There's been provider bias, misdiagnoses, and a lack of cultural competency. We have to demand better and seek out the resources that will meet our specific needs. Here are some organizations that you can check out that might work for you or someone else that you know. But hopefully now you know there's no shame in going to therapy. Now, if you have any additional resources that you want to share with this community, please let me know by leaving that information in the comments below. And also, if you go to therapy and love it, drop a hey, because that's what we need, is just more transparency. Until next time, y'all, I'm Jessica. Bye.